Okay, let's talk about urothelial carcinoma of the bladder, also called transitional cell carcinoma. Most common tumor of the urinary tract system can occur in the renal calyces, the pelvis, the ureter, the bladder. So coming from the calyces, the pelvis of it, the ureter itself, and the bladder. All along, it can arise from anywhere. Can be suggested by, again, painless hematuria, but no cast. Painless hematuria associated with problems in UroP-sac. So what is this associated with? It is associated with phenacetin, tobacco smoking again, aromatic amines found in dyes, and cyclophosphamide. And looking at a picture histopath, that's the transitional cell that have become. These are the transitional cells. They resemble normal bladder epithelium, but if you look with irregular architecture, that's the histopath. So they resemble normal urothelium, but with irregular architecture, and you will see hyperchromatic nuclei. You can see a lot of blue hyperchromatic nuclei, and atypical mitosis will be seen, and pleomorphism will also be seen. So this is the histopath of a urothelial carcinoma. Some occupational, let me also mention here that although this is associated with all of them, plus some occupational exposures. Which occupations are we talking about? We are talking about in the rubber factories, or plastic, or the dyes meaning this amine dyes, right? And these dyes are in the textile factories. Okay. One other thing we need to also think about is the tumor stage of this thing. So the tumor stage is most important factor for the prognosis, and it is based on and that is based on the depth of invasion into the bladder wall, and the degree of spread to the other tissues. So depth of invasion into the bladder wall, and the degree that if it goes deeper, is it going into other tissues or not? That tells us the prognosis of urothelial carcinoma. So, but how do we know if if the tumor has invaded into the muscular layer of bladder wall, if the tumor has invaded the muscular layer, then that's already poor prognosis. So that's pretty much all we have for the urothelial carcinoma of the bladder.